Welcome everyone to the Exoskeletons and Wearable Robotics podcast, episode 12. Today we have Matt Marino and we'll be discussing pediatric exoskeletons. So hi everyone, this is Tom Sugar with the Wearable Robotics Association, myself, Bobby Marino with the Exoskeleton Report, and special guest Matthew Marino. Before we get started, we have two new Patreons, George and Caro. Thank you so much for your support. We want to take the time to also acknowledge our current VIP tier supporters, Volker Bartenbach, Rita Vasquez Torres, Minmar, and corporate level sponsors, Humotech and Oxivo. Hi guys, how are you doing?
Good, Bobby.
Doing well. So we're happy to have Matthew Marino as our third podcast guest now. I'm starting to lose count. How wonderful. Matt has 20 years of experience in physical rehabilitation, health, fitness, human performance, ergonomics, injury prevention, and the design and testing, use and implementation of wearable sensors and exoskeleton technology. He has been working hands-on with exoskeletons since 2015. Matt has been involved in the creation of standards for ASTM Committee F48 on exoskeletons and exosuits since 2017, and he has been a leader in the safe and effective implementation of exoskeletons for injury prevention and return to work for injured workers to their job. Matt and I are both founding members of the ASTM Exotechnology Center of Excellence, and together we have collaborated on several projects already. He's the owner of not one but two companies, Evolving Innovation and Pride Performance. And most importantly for today's talk, he is also a father. Matt, did I miss anything?
No, I think only that I'm a father of a child with a disability, what is going to be a lifelong condition that he lives with, which is cerebral palsy, or CP for short.
Can you tell us how cerebral palsy affects him, roughly speaking?
Sure. Yeah. CP it's actually a fairly common disability where a child, a baby, is injured right around the time of birth. It can be shortly before, while still developing in the womb. Something like a stroke in utero will cause CP. It could be the result of hypoxic ischemic encephalopathy, or HIE, at birth, where a baby is deprived of oxygen for somewhere between 10 and 15 minutes. We learned at one point from physicians that babies are pretty resilient creatures and they can go without oxygen for up to 10 minutes and usually turn out totally normal, just fine. But if they're deprived of oxygen for more than 15 minutes, they will typically die. So it's this like magic window where, if they're deprived of oxygen for 10 to 15 minutes, you'll have an outcome of HIE and ultimately CP. So it can present in a lot of different ways. A really common form of it would be spastic diplegia, where both legs are affected, but there's a pretty good or normal even use of the upper extremities. It could be hemiplegic, like a stroke, where one side of the body is affected and not the other. Or it can affect all four limbs and be quadriplegic. In his case, he has what's called athetoid CP, or chorioathetoid CP. So he has like a lack of tone and muscle control in places where he needs it, and then like overflow of tone and muscle movement in other places. So he might not even be thinking about moving his body, but you'll see his limbs moving through space, and it's out of his control. It's completely involuntary. So really his CP is characterized by dystonia. And so he just has trouble controlling his movement.
So then this is where pediatric exoskeletons can come in, because we're not looking for a digital solution that tells us how the movement can be done better. There needs to be a physical assistance to help execute those body movements.
Yeah, what he really needs is an assistive device, something that can help him move more normally, I would like to say, but I don't know that even an exoskeleton will help somebody like my son move normally, right? I think we throw this word normal around when people have a medical condition, and really what we're going after is some type of functional improvement, the ability to do something that they can't otherwise do. And we talk a lot with exoskeletons about providing assistance to do these types of things. But what I found is that with some types of movement disorders like Luca's, what we actually might need is movement resistance, something that would dampen his movements, help him control them, almost like resist them and slow them down and provide stability at certain joints so that he can move others.
Yeah.
Yeah.
I'm thinking of just two quick things. One is people that have tremors
Mhm.
have talked about using resistive devices to reduce the tremors. On the other hand, I've seen two other ideas. One idea is actually you increase the tremors, which tells the brain, hey, there's a problem. And then the brain says, okay, let's reduce it. So you actually up the tremors and reduce it. And the third thing I've heard of is exactly what Matt has talked about, where if someone has tremors, you hold the forearm and that helps to stabilize, and then they kind of reduce tremors. So I've heard of three things where someone has worked on like a spring device that holds the forearm for Duchenne's disease. That was helping some.
Yeah, it's something like that I could see working pretty well. Then the challenge becomes, let's say it's not even a wearable, it's just an arm that attaches to something that does that. How can you easily attach it to the seating system that you use at home and then easily take that off and attach it to the wheelchair to go to school as you're running out the door in the morning to try to get there on time? And just the ease of use of a lot of those products, like you either figure that out or you have to buy multiples of these things, and we can get into the cost of buying those, because we like to have a walker that he uses in the house and a walker that he uses outside of the house for obvious reasons. He just started using the Hokuma Lokomat, the pediatric sized robot at Shriners Rehabilitation Hospital in their rehab department. They have one of those. And I'm somebody who's been working with these products for all of these years, and I didn't even know that they had it there. So if we talk about like what are some of the challenges, well, clearly these machines are out there, but even people like myself who specialize in their use and implementation don't even know that they're there and available, because I might have been taking him in for gait training with that device years ago had I known that they had it. The product that we used was the Exo Baby, the version of the Exo Band from Moveo Walks, Italian company. Really easy, simple to use device, lightweight. It's kind of like a climbing harness. You put a waist belt on, adjust that. You put a couple of leg loops on, one leg loop on each leg, make sure that those are properly placed and adjusted properly. And you connect them with a couple of ratchet straps that have a spring in line. And as he walks with that, he's getting a little bit of exercise with it. But it did some magical things. And we could see him standing up straighter. His core stability improved. His balance on the stance leg was improved. His steps were longer. His walking speed was slightly greater than it was without the products. We saw all of these improvements in his walking with just daily use of the Moveo Exo Band product, or the Exo Baby version. Those are the ways in which so far we've been able to use some of the new products, or not new in the case of the Hokuma, right? That's been out for a long time for our own use as a family for the kiddo. Yeah.
And to the best of my understanding, at least what I see in the literature is some sort of a connection between mobilizing kids with cerebral palsy and then that paying off throughout their adult life.
Oh, yeah.
Can you guide us through that? What is this mechanism?
Yeah, this was really nicely illustrated. And it was a physician in this case who basically came back and said, any exercise that somebody with CP does is beneficial for them now and over the course of their lifetime. That's the mechanism, exercise. And if you read Peter Attia's book, Outlive, like, exercise is a powerful, powerful medicine for health span, lifespan, quality of life, longevity, all of those things. You can also look at the research on exercise like resistance training for people with cerebral palsy, strength training, power training. All of these things help improve their overall function at the time that they do the exercise, as well as having lasting effects. So yeah, giving a kiddo with CP an exoskeleton that helps them be more active, take more steps, get more exercise in their day will be beneficial for them now and in the future. Because I like to say things like this they have like a compounding effect. It's like compound interest. You build up your status and your function early on, and it just continues to build on itself over time. Unless you have setbacks, of course. And this is what usually gets people in old age is they're doing great, motion is lotion, move it or lose it kind of thing. They're doing great with their exercise, and then they fall, they break something, they're not able to move, they're not able to exercise, and those types of setbacks are extremely debilitating and ultimately lead to people's demise later on in life. So the opposite is true early on. When you're a kid, when you're a teenager, especially, that's when you're building your base of bone density and your base of muscle mass that you're going to take with you through the rest of your life. So the more that you can get these kids doing at a young age, and especially into adolescence as well, the better off they're going to be, not just now, but forever.
Which is also a strong case for pediatric exoskeletons, so any mobilization device. And then what was your experience with Hucomo, the pediatric version of the Hucomo?
It's been really, really great so far. I'm not the provider of the therapy in this case. If I was, my kid probably wouldn't do anything, right? Because I have to play the role of dad and physical therapist, and there's a fine line between the two where if I'm a little bit too much of a drill sergeant instead of a dad, then we have a problem with our relationship. So we take him to other therapists for treatment. And the therapist at Shriners who's been helping him use the Locomat has been great. There's some measurements that they have to take ahead of time so that they can size the robot accordingly. But then once they get it in, it's a few little adjustments and tweaks to make sure that like his feet are hitting the ground with the right amount of force and that everything is lined up properly and the joints are in alignment and he's able to move in it comfortably and it feels comfortable and it's not rubbing too much on his skin or pressing too hard in ways that become too uncomfortable for it to use. And it has like a display on it. So there's some gamification to it as well. And he really enjoys being in it and using it.
Another question. Have you ever tried any, what I'm going to call more like fixed frame? I'm not going to call them exoskeletons, but like fixed frame systems. So I'm thinking about these kind of walker systems that kind of have a hoist on top to help you with the like partial weight bearing training. So just, so you just have less gravity on those legs and then walk more. Any thoughts there? I know that that's not exactly an exoskeleton, but I think here we just want to talk about robotic systems, that can just help.
Yeah, I would put the Hokomo, the Locomat into that bucket, right? It's got that sort of gravity compensation where it can have the person not weight bearing at all, just moving the limbs. It can have the person doing some partial weight bearing. I don't even know like how much weight bearing it goes up to. I'm assuming he gets it like 100% weight bearing, full weight bearing. But again, like I'm not an expert in that particular device because we only recently started using it and I haven't been to enough sessions yet to really like pick the therapist's brain about it if he even knows all of the answers to it. So I'd say like that's something like that. But then the neuro rehab clinic that we take him to on a regular basis, they have, ceiling systems, harness systems that allow you to offload in like tiny little increments so they can really dial up or dial down how much weight bearing the person is using in those. But there's no like exoskeleton or robot associated with those things. A lot of the kids already wear some type of orthosis. So a lot of them will have an AFO or KAFO or something like that, and they'll be wearing those while using some of those ceiling lift assist pieces of equipment. I wouldn't even consider that like a robot. It's just, there's a little remote control that hangs down from the unit and the therapist controls that. And, they're looking for the qualities that they want to see in the gait of the person using it. They can be used for gait. They can even be used for quadruped activities like crawling and supporting some body weight there. So yeah, we've done those. The clinic also has, I don't know if you've heard of TheraSuit, the TheraSuit method. It's like an exosuit. It's got, pieces that you wear on different parts of your body that you connect with like little, let's just call them rubber bands, little pieces of elastic that come in different strengths. And it's really interesting to see how the body of somebody with a movement disorder responds when you load it and you pull on it in certain ways with these types of little elastic elements. They wear that. They have a harness system in this like cage that they call spider, and they'll attach the harness to the cage with different levels of elastic as well. So different strengths of elastic. So that's another way to sort of support body weight and offload body weight in a different type of way than the powered like ceiling system. So yeah, we've done and continue to do all of that stuff, because when you're treating the nervous system, the key is to make the task challenging but not difficult. That makes sense. If it's too difficult, the compensations really kick in, and it sabotages what you're trying to do with the rehab. That golden ticket is a task that's just challenging enough that puts the person right at the edge of their mobility and stability and ability to function in that position for that task, where you're seeing the things that you want to see from them reflexively. Like you were talking before about, making the tremor worse. And I call that, and when I'm in the clinic, I call that feeding the mistake, right? So if somebody, let's say like an athlete, because I work with neurotypical folks in our PT clinic, if they jump and land and their knees just buckle inward, valgus collapse, sometimes I'll get them to do those same exercises and I'll pull their knee in even more. And they feel that, and they automatically, like reflexively adjust and eliminate the problem altogether. So there's some little hacks and tricks and things that we use when we're doing therapy that's really geared more towards the nervous system than the orthopedic, the musculoskeletal system, like most people will think of an outpatient PT, because every musculoskeletal problem is actually also a neurological problem, and it needs to be treated that way. And vice versa. In a lot of cases, these neurological problems develop into musculoskeletal problems.
I mentioned just a couple things, not the names of the company, but there's some companies where they have kind of a harness system that's attached to a walker. And then also about a systems where they have air and you get on top of a treadmill and air holds you up.
Yep.
And you do some less, and it's less, and then you kind of walk on a treadmill. Because I've kind of heard, I had done some stroke rehabilitation, I don't know, at least 15, 18 years ago. And it was always about, they always talked about dosage too. Just, get the person walking and walking and walking. So.
Yeah, you have to, it's that minimum effective dose of exercise, and you can definitely overdose it, right? That's when people get sore, or they're so fatigued then they can't even come back the next day and participate, right? So it does have to be dosed properly. I think with the first example that you gave, you're talking about something like the Trexo Robotics system, where they have their exoskeleton, let's call it, attached to a Riften pacer walker. But I think what Trexo is doing is fantastic. We have really good friends who have a kiddo with CP who uses it every single day at home. The second example, what was the second example that you brought up before?
Air pressurized.
Alter G. So it was the Alter G. So Alter G, I believe, got sold to Rewalk or LifeWord, right? So it's a LifeWord product now.
Yes.
There's another product out there which may or may not be exactly the same. It's called Boost, the Boost treadmill. So that uses air to basically blow the person upward and ultimately like offload some of their weight bearing. One of the gyms where we have a contract to operate out of, it's called Evolution Healthcare and Fitness here in Portland. They have one of the Boost treadmills, and it's great for return to running protocols for runners who've been injured. They're more of like a sports outpatient clinic, so I don't think anybody's really going in there with like a neuro issue, like a motor dysfunction, and using it. I could be wrong. I'd have to reach out to Brad, the owner, and ask, but I don't know how it would work for that. All I can say is you have to zip yourself into it. You have to put on like a special pair of shorts, and you have to be able to get on it and get into it and zip yourself into it. So it wouldn't be the easiest thing to use without some type of like a ceiling like lift assist type system, or like a Hoyer lift to get somebody into it.
Wow. You have had so many touch points with pediatric exoskeletons, real touch points.
I made a list of these things. Like we've talked about TheraSuit, we've talked about Locum Hokuma, the company over in, I believe it's Spain, Marcy Bionics. Looks like they're doing some interesting things with a pediatric exoskeleton that's, attached within a frame that they're using for kids. Looks like with CP and other types of conditions, maybe spina bifida as well, and some other potential neurodevelopmental issues. Angel Robotics, Bobby, I don't know if you know if they're still around or not, but if I remember correctly, they have an exoskeleton for kids. We talked about Trexo, we talked about Moveo Walks, we talked about Bionic Power. The only one I've missed so far or haven't touched upon is Biomodem, and they're based here in Portland. And I do keep in touch with Ray and the team over there, because I think they're doing some really interesting things with ankle exoskeletons, but potentially also other parts of the body. Tom, you probably know Zach Lerner from Northern Arizona University and some of his work. So they were really looking, again, specifically at exoskeletons for kids with CP, which is why I got really interested in what they're doing. And I still think they have a lot of potential. But I think one of the big things that this whole industry at this point is lacking and needs is investment.
Right. Yeah, I would completely agree. People, and I think it's the whole package. It's people knowing that these practical, realistic, non-science fiction devices exist, and understanding what they can do for thousands of children. I'm not even entirely sure what percentage of the population that can affect, and then completing the full picture, that to get this technology to be more readily accessible, bring the cost down, refine it, make it easier to use. It needs investment.
It needs investment. I kind of shook my head there a little bit, just thinking about, if you talk to venture capitalists about durable medical equipment, they're not really interested. And the other thing that I was shaking my head a little bit about is that it's always this chicken and the egg. Like, people want, and there's a huge need to develop the devices, but the expense, is tougher. And we were discussing, Bobby and I think in a previous podcast discussed this a little bit, where I think there's a little bit more money and effort in Europe with the socialized healthcare systems, where, they're thinking about the entire community. And we won't get into those, healthcare issues much, but it's tough. It's tough. That's a tough arena. Funding there, I also think, I think I said this before once in a podcast, I give Zach Lerner a lot of credit, because also it's tough to do research, pediatric research, because it's just a lot more difficult, and there's these, what they call institutional review board committees. And so people that aren't in the industry would understand that as much, but basically, to get IRB for people that are 18 years and older, it's much easier to get IRB approval for pediatrics. And so that's why I said I give Zach Lerner a lot of credit, working really hard in pediatric exoskeleton.
And we absolutely are talking about a healthcare issue. Like, these are kids with disabilities, right, that need pediatric exoskeletons. Like, I'm not even going to go there and say that, kids need exoskeletons for recreational purposes or as exercise equipment at this point. Like, there's so many ways for kids to play, have fun, and exercise, that that shouldn't even be on anybody's radar. What we're really talking about here is kids with neurodevelopmental issues and other types of disabilities that are preventing them from playing, exercising, and moving normally in a world that is just not designed for them at all. And just this hope that I hold out for, the exoskeleton industry to get the investment that it needs to build the products. It doesn't stop there, though. It's like I said, a super complex issue when we start getting into, well, who's going to pay for it? When we have families like mine, a kid with CP costs 10 times more to raise to the age of 18 than a normal kid. So, I mean, we're already stretching. Now you want us to buy equipment that costs thousands or tens of thousands of dollars. And I mean, we would be willing to, if we could, if it was something that we could trust, that we knew it would work and that it would be helpful in the ways that we believe it would be helpful in, like, we'd figure it out, you know, we'd figure out ways. And I think a lot of families are in the same boat where they would figure out ways, or they'd go sniffing out funding, look for grants, they do whatever it takes to get that product. But really, at the end of the day, these are in some cases powered orthoses, not too dissimilar from AFOs, KAFOs, and some of the other archaic interventions that these kids already wear that insurance companies already pay for. We're just trying to get newer, better, more effective versions of these things out to people that absolutely need them. But now we got to start barking up the insurance tree a little bit, and we got to start figuring out the reimbursement for it, because let's face it, the vast majority of families in these positions don't have the thousands or the tens of thousands of dollars that they would currently need to get these things. And we pay so much money for insurance premiums to get care and products, assistive devices, and coverage for things like this, that it just seems to make sense. Like, you know, that's what we pay for those things for. Otherwise, like, what's the point?
I understand. I mean, we've got to help people walk. I mean,
Yeah.
mobility is super important. You know, I've thought about mobility for 20 years. I
Yeah.
hope we can keep doing that, you know, with prosthetics and orthotics. I'd ask you, I'd like to bring up a thing there when you talked about bracing and things. What do you think of this? There's this dichotomy between, you know, like exoskeletons and then powered bracing. So I'm thinking about some of the microprocessor braces that are in the prosthetics, orthotics
Like the
arena.
C-brace.
Yes. Something brace. So what do you think of some of those things? Have you tried some of those, or
Well, I mean, none of them like fit my kid, so no, I don't need one.
do they make a pediatric version of those?
You know, it's a great question for the people over at Autobach. I don't think so. It hasn't been sort of presented to me by a therapist or a doctor as an option, right? And isn't that how the vast majority of patients and people in our position find out about these types of things? We don't find out about them on the exoskeleton report. I'm sorry, Bobby. Like, I love your website, and I'll do anything to help you continue to keep this information out there and free and publicly available. But where people find out about this stuff is from their therapist, from their doctor. And if they don't know about it, they're just not finding out about it, you know? So that's a big challenge.
Well, maybe we need to educate the doctors, because so when I was in the prosthetics industry, it was interesting. The physical therapist or also the prosthetist, both of those people, they weren't really making the final decision. I don't know, maybe you could weigh into this a little bit too, but this is for the US market, where it's like the doctor makes the decision and then the decision flows down, I guess is the way I'm going to say it.
Yeah, I mean, that's the same thing here. You still are going to need a prescription or an order from your doctor to get insurance to even pay attention to a claim that's submitted for something like this. Like, it's just like a walker or a wheelchair or anything else that you would get. So there's still that hierarchy, and you still need those medical healthcare professionals to know about these products so that they can recommend them to the patients. I mean, that they're like the gatekeepers, I like to say. Like, you're not gonna find your target market if you're like, let's say, a hand exo company. Like, look at BioServo and the carbon hand. I put that on Luca, and it actually worked really well. And they have an extra small size glove, so we could add a couple of companies to the list of potential pediatric exoskeleton companies. There's BioServo with the carbon hand, and there's Cerebral. I don't know how to pronounce it, but they have another hand product. Anyway, like, in order to get that product, you still need to have a doctor's prescription, even though it's a cash pay product at this point. It's just the way it is.
Well, let's maybe take the conversation a little slide. Like, what do we need to do to make, you know, so that the industry is even better 10 years from now? And I'll give out one example that I think I just heard, which is I was always inviting sometimes physical therapists to a WearCon conference in the US, but I'm wondering if we should have invited medical doctors And which doctors, or should we be taking these devices to some, medical conference or something like that? But anyway, I just throw out there, what would you want to see, Bobby, or what would you want to see over the next 5 to 10 years? Or let's make it shorter. Over the next 5 years, how can we improve?
Oh, there's so much work to do, in my opinion. I don't, it's not like just one thing, it's so many things. The doctors definitely need to know about these products, but they're not going to care if they can't see solid research supporting them, and if they can't see that there's a way to get them paid for their patients. They won't even look at them. They won't even want to hear about them. If there's a session at a conference where they're at, they won't go to it if those pieces aren't in place. Like you really need to have that access and that reimbursement piece figured out. So, I know that there's been some fairly recent developments, with the FDA and with Medicare, Medicaid, establishing some approvals and some reimbursement dollars and cents type numbers that apply to some of these devices, but not all of these devices. And they're probably still, if I'm a doctor or thinking with my hat on and thinking like evidence-based, although I prefer evidence-informed practice, is there just aren't, enough randomized control trials and, things that can really prove that the exoskeleton works, and not just that it works better than, equal to, or better than the current standard of care, right? So those are things that really need to be there, because I think if we just keep thinking like anecdata and stories and things like that I'm really interested in, because I'm really passionate about implementing these and getting them on people, right? The stories are out there, but it's just not, the evidence is just not compelling enough, I think, for the doctors and the insurance companies and the powers that be that are really controlling the money on all of this stuff at this point yet. So there's so much work to do, Tom. I don't even know where to begin. I can't even begin to answer that question. It's like, we're all involved in standards. So is it standard so that we can talk about things the same way? Yes. Is it test methods so that we can test things out and have ways to compare apples to apples? Sure. Is it making sure that these things are safe? Yes. Is it making sure that they can fit everybody who potentially might want to use them? Yeah. I mean, that's a huge problem, and not just fit comfortably, right? Because the comfort is a really important factor, probably the most overlooked factor out there with exoskeletons. Easy to assist people with them. It's really hard to do it comfortably on a squishy, sensitive body. In some cases, with people who are experiencing disability, there's a lot of things to think about here. The doctor knowledge of the product, therapist knowledge of the product, the governing bodies like the American Physical Therapy Association and the occupational therapy associations and the medical associations and groups like that I don't know if they're in the know on exoskeletons or not, because I'm not heavily involved in those organizations, right? Like I'm in the clinic, or I'm doing consulting work depending on what day of the week it is. And there's so much work to be done. Like I said, those are just a few examples of things, but there's also a lot that's needed in the development of new products and better products, improving the products that are out there already. So
No, that was a great list. And I think about that, you talk about, evidence-based research. There's a lot of evidence-based research, at least in this drug rehab, where, reaching and feeding, if you do a lot of repetitive motion therapy with arms, they see a lot of benefit. They have never, at least I should say this, we haven't seen as much, I should say it this way, we haven't seen as much benefit from lower limb systems, whether it's exoskeletons or bracing devices or whatever. It's interesting. It's harder to get people to stand up and walk than, I guess, if you're sitting down and reaching, anyway, maybe you've seen that yourself, but
yeah, if your hands are tied up with a walker handle or crutches, when you could be independent with your hands and be able to use your hands while sitting in a wheelchair, what are you going to choose, right? If it were me, I'm going to choose being able to use my hands. And I think that's what a lot of people who continue to And honestly, like there just isn't a great option for exoskeletons that are self-balancing, that free up the use of the hands, that are safe, et cetera. Like we know from the Olympics and probably even before that, what the watercraft people, what they're doing over in France is fantastic. I think there's another product that I saw just came out recently, Bobby. Maybe you remember what it's called, where it's like the user enters like the back of the exoskeleton, kind of like front facing, makes it a little bit easier to get in, get out of it. And I believe that's also a self-balancing option. So then you can do rehab tasks with your hands, and maybe in the future you'll just have your hands free to do whatever you want. The challenge with those types of self-balancing devices, powered devices, is one, like they're going to cost, a lot of money. They're going to take up a lot of space in people's houses. They probably need like a dedicated storage area, that's convenient for the patient or the person to get in or get out of, right? And they move really slow. Like try getting my kid to strap himself into something like that, only to see like his little sister or his friends take off and not even take off, just walk away, because the thing only goes like a mile an hour or a mile and a half per hour. So the speed of them is another challenge. How do you keep it safe? How do you keep it balanced if it's moving quickly? There's just so many technological challenges there. So I have a lot of hope, like I said, that this industry continues to improve and develop, and that eventually one day there are not just one but many different products that can serve my kiddo in the different ways that he needs it. Because I don't know if there ever will be a single product that can do it all. I just have my doubts there, I guess. We'll see.
Makes sense. Any other thoughts or questions? I don't want to go too much over time.
I don't know. I don't have any other major topics that I can think of off the top of my head. Like I could obviously talk for a really long time about, being a parent of a kid with a disability and all the different things that we've tried. Like we've tried eye gaze systems for the computer. We've tried glasses that have like a head pointing, like almost like a laser type thing for him to access compute. You know what he likes? He likes using an iPad with an Apple Pencil zip tied to the brim of a hat. And you can play games and do schoolwork and do everything on his iPad that way. So we're constantly like battling with the school to like get the teachers to make the assignments so that he can access them. It's accessibility with all of these things, whether we're talking about like tablets, computers, or exoskeletons, just the accessibility of these things, like building them in a way that people with the disability can use it. And not just one type of disability, potentially many different types of disability, and how independent can they be when they're using it? Can they do it on their own if they don't have good function of their hands, or are they going to need a caregiver or a parent to help them do it? These are all really interesting considerations that the producers, the designers, the producers are going to need to think about, which is why it's so hard. I think it's going to be so hard to make one medical exoskeleton that can do it all, right? It's really, that's like such a huge lift. I'm very hopeful, but I don't know that I believe that there's a chance that that's going to happen or not. I want to think that there is, but
I mean, for me, it's like, that's why I own, you own a pickup truck and you own a car to drive to work and you own a minivan, right? So
yeah.
I have, right? So I don't have one car. I got three.
Yeah, we were exploring this recently. Like if he's going to play wheelchair soccer, how are we going to get the freaking wheelchair to the soccer matches, to the soccer practices? Like it's one thing to lift a walker or lift a travel chair that weighs like 60 pounds in and out of a van without a ramp or anything like that, just a regular minivan. It's another if it's like 150, 200 pound power soccer wheelchair with like metal tubing all around it. And it's like how are we even going to do that? So we explored wheelchair vans, and like you start getting into that world and it's like, whoa, okay, this is really going, this is really going for it, right? Looking at the big ones, the sprinters, the big like E-Class or E-Series Ford vans, all the way on down to like the Toyota Siennas and the minivan type options. And it's like, well, there really is no good option. Like as soon as you modify the van, cut the floor out and put the ramp systems in and stuff like that, you actually lose a lot of space inside of the vehicle. I'm like, all right, well, where's the little sister going to sit now? Talking with the sales guy, he was spinal cord injured in a wheelchair, was that we were just going to go to Harbor Freight and get like $1,000 trailer and just roll the power soccer chair up onto the trailer, cover it somehow. Maybe we'll get a more expensive enclosed trailer. I don't really know, but we could probably even tow that with a minivan. It's not going to be that's not going to be that heavy, and it won't be that expensive. Instead of spending anywhere from $60,000 to $100,000 on a wheelchair van. Like, all right, we can do the same thing we need with a $1,000 to $6,000 trailer that we can just tow when we need it, you know?
I bought so my kid is racing a kid cart, these kid carts, and it was like you could buy a Sprinter van, but the Sprinter vans are $79,000.
Sure.
That's ridiculous. Or I could buy a $2,000 trailer where you flip the back flips down and you just roll it up the trailer. So what I did see people do is they go to Harbor Freight, they buy a minivan and they go to Harbor Freight, they can buy some ramps.
Yeah.
I don't know how good those are either. But anyway, I've seen people do ramps, and anyway, I bought a trailer, even though I absolutely, and then we gotta finish up here too, but I actually sucked. So everyone makes fun of me because they're like, oh, here comes this professor trying to drive a trailer, because you have to, like, at the racing match, if you get there late, you got to get your trailer into like a little spot. And I'm not good. I'm not good at backing up a trailer. I need more practice. So anyway, if it's at it, go for it. If you're good at it, just buy a $2,000 trailer and be done with it.
That's probably what I'm going to have to do, to be honest. Because right now we have a 400-pound power wheelchair that we're borrowing from somebody on the power soccer team. And so we're managing to get that in and out of our current minivan with a 5-foot aluminum ramp that will also fit inside of the minivan. That's a pretty steep angle, and you're pushing like a 400-pound chair up there, and the ramp is like just wide enough for it. So it's like a little sketchy to try to drive it up in there, because if you drive it off the ramp, like, you're in trouble. Let's just say that. And the chair's in trouble, and then the kid's going to be upset because we can't go play soccer anymore, you know? So yeah, we're just figuring it out. And that's ultimately what we have to do when we're parents of kiddos with needs like this, is we just have to figure it out, figure everything out, because nothing is designed well for us. Nothing. Right. So my hope is that the exoskeleton companies can get it together and design some things really well for us, for these kids who then become grown-ups, who will then need grown-up size versions of whatever exoskeletons they're getting benefit from too. So it's kind of like a never-ending cycle with these things.
Yep.
Thank you, Matt, so much for your time. Having that first-hand perspective, a parent and an exoskeleton expert at the same time. I am assuming that there's maybe 5 people. I know of only one other person on the planet like you. So it is such a unique opportunity to have you on the podcast, where you can speak to pediatric exoskeletons from both points of view, both as a producer, as someone that knows how to apply them, and someone who has a kid who needs them. So I hope everyone enjoyed this episode. And if you want to see more of these podcasts, please support us on Patreon. Thank you for your time.
Thanks, Bobby. Thanks, Tom.
Thank you all. It was a wonderful conversation.
I second that.